months since I was diagnosed, and it's been a really long process of figuring out the best ways to manage this disease. There's a lot of different resources that my educator has given me to help me process through the different ways of managing my diabetes. On a daily basis, I use 5 or 6 apps to help myself manage everything. So before I eat in the morning, when I wake up, after I eat, before I exercise, after I exercise, just different apps, to calculate how much insulin I'm gonna take, see how my body is reacting to it. So having everything in one place would be really convenient, because a lot of times, your doses change and, everything can be kind of flexible. So to have to go through all of those different apps and adjust everything continually can be a little bit of a pain. So to have it all in one place would make it a lot easier.
I wanted to do something at Methodist Hospital that would be a meaningful way to remember Corbin. And knowing my husband, I knew that a room or building probably would not make him a very happy person. However, doing something for his patients would make him extremely happy. We decided that one of the best things we could do that he would be just thrilled with would be to incorporate technology in some way in this gift to make his patients' lives better.
The hope is that this will decrease the influx into the ERs and all those things, because they could have the sources available at hand instead of making that phone call to their primary care or even to their endocrinologist, then waiting all day to maybe hear from that on what they should or shouldn't do with what's ever happening with them. They've got that tool right in front of them.
Dr. Roudebush was very committed to education, whether it was medical students or residents or fellows. And he always had time to sit with our educators and review cases and answer questions. He sent us many of his patients so we could help them develop their own skills and knowledge in managing their diabetes. The other thing I appreciate about Dr. Roudebush, he was very forward-thinking. He recognized that endocrinologists see a subset of patients with diabetes and that primary care physicians manage the vast majority of patients with type 2 diabetes. And he helped us develop tools to help the primary care physicians do a better job in managing. And oh my goodness, how he loved technology.
I think the biggest thing is just to help the diabetics out there in Indiana and give them something, give them an extra tool besides that phone call.